Thank you very much. It's a pleasure to be here and to talk about the work of the Black Equity Coalition. We are a coalition working in Allegheny County, Pennsylvania, which is Pittsburgh area and vicinity. And we've been working since the pandemic started in April of 2020. Next slide, please. Yes. So we are, in April of 2020, like most people, seeing news articles about the stark racial disparities in COVID-19. Was not a surprise to many of us. I've worked in disparities in chronic disease outcomes for the past 20 years and work on the social determinants of health. So many of us anticipated that this would be the problem, but we didn't exactly have the data. And so data coming out of other cities sparked interest in what the numbers were for our Black population in the Pittsburgh area. Next slide. So a number of things happened organically together to form this coalition. I'll just mention a couple because I don't have a lot of time to talk about the coalition. And I will put an article in the chat about the development of this coalition. First, our Pittsburgh Black elected officials were advocating to our major health plans in the area to provide testing resources in Black communities. They brought some content experts and physicians to those conversations, so I was a part of those conversations. We had some of our community leaders doing social media town halls about the increased risk for Black populations and how we should protect ourselves. We had some of our community funders working with Black businesses and working on that with them on how they could sustain themselves, how they could apply for government benefits. And then we also had a foundation program officer who had brought together a bunch of data scientists to really try to understand the numbers. And so that's what I'm here to talk to you today about our data working group. But all of these things happening organically with many of us being in these overlapping spaces, our coalition formed. So we were formed in April 2020. We were a group of physicians, researchers, epidemiologists, healthcare practitioners, funders, elected officials, all working on an equitable response to COVID-19. And we're working in the Pittsburgh area. Next slide, please. So we operate on a hub and spoke model, and this is just an example of our working groups. So our core leadership group, we call the huddle, and we have working groups in many different areas that work with partners. So, the BEC and the huddle is the hub. The community organizations are the spokes. These resources around the spokes are things that we have produced. So I can't go through all of the working groups, so I'll focus just on the data working group. Imagine that you are a data scientist, a software engineer, and this pandemic is happening and you don't know what to do. And so the program officer brings you together, and I'd say 30 to 40 people showed up consistently to have these conversations about getting race and ethnicity data on Black populations and other populations in the Pittsburgh area. And so we work closely. So I'm from the university, and one of our major partners from the Western Regional Data Center that's worked with the DASH project. We're from university, we have community-based organizations, and we are working closely with our local and state health departments. Next slide, please. So as I mentioned, we came together organically. So these are actually activities that we are doing right now. So, but this could be a vision for other partners. We envision equitable data collection, particularly accurate, transparent data on race and ethnicity and other social determinants of health. We use a data to action approach. So what's been different about this data is the data that we get, we feed it directly to communities and to organizations and stakeholders, and they can take action in it. Normally in my space as an epidemiology, that would take decades, years, decades for our data to be translated. We do some direct translation of data to communities through social media. We have a community coordinator that has community conversations. We've done some data literacy activities, which I found to be very interesting, where when we're out doing community vaccine events, we bring the numbers and we have a table with us and we engage the people who are getting vaccines on some data activities. And of course, one of our values and visions are to be transparent throughout the process. Next slide, please. So with respect to developing trust and trustworthiness, one of the unique things about our coalition is that we are Black-led. And we are Black-led from a perspective of not just community, but community leaders, university leaders, foundation leaders, and we're supported by allies. And that's a very important point, because even just me being here doing this presentation, one of our allies suggested that I do this presentation instead of him. And that's kind of how we have been working, because we really want to support the Black-led leadership. We always have input and validation from community. We are advocating for data that is directly relevant for community. We have shared decision-making and community ownership. So even though I'm talking to you just about the data working group, that's across the coalition. But for example, our data working group, I brought this presentation to them and we talked about the things that I would discuss here with you today. And we are also addressing oppressive systems and racism, not just education at the individual level. And I can say that that was how health plans, departments were approaching us in the beginning. Please get our messages out to your community, and not from an equitable approach of how do we address the systems that are responsible for a lot of these outcomes. It's not all about individual level education. It's about equity and sharing of data access, data resources, and other resources. Next slide, please. So our economic model. So as I mentioned, we have been on a volunteer basis for this year. So if you can imagine, our data working group has been meeting twice weekly for 2 years. We on average have 10 to 15 participants. We've had as high as 30 participants in our working group meetings. So we are in desperate need of support for it to be sustainable. So our initial grants were from our foundations, local foundations, or for organizational infrastructure. Now we have a large grant from the state of Pennsylvania for outreach to communities. But there is not funding for the data infrastructure, the analysis, the translation. And as we've talked earlier in this conversation, a lot of the data infrastructures from the health departments were not set up to give us the data that we needed. And so investment in those types of issues behind the scenes, things like data systems and data integration, and even all these negotiating agreements that you have to do behind the scenes to get access to data. Next slide. So just quickly on our outcomes, we had a whole context that we have talked about earlier that had changed the landscape of racial equity, prior to 2020 and during 2020, and certain things that are local to our region. But for the 2021 period, we have done a number of things, including we got testing put in our federally qualified health centers. We got the health department to do that through advocacy. We also got the health department to let us hire contact tracers within federally qualified health centers. With respect to our data, we advocated to get data published on the website. We have created our own dashboard, which I will put the link to when I'm done, that manipulates the data in a way that we can understand the racial differences. Our data group has won a number of awards through the Neighborhood Indicators Partnership and through the Census Bureau. And we, early last year, when vaccines were starting to be distributed, we noticed some inequities, and we did a report called Missing Our Shot to really highlight those and bring stakeholder awareness to those issues. Great. Next slide, please.
And that's supposed to be the last one, Tiffany.
Okay, sure. So these are results. So you can skip this one. These are results of some of the things that I've talked about, but our lessons learned are facilitators and barriers. So, we're collaborative, we're consistent and reliable. So community trusts us. Within our group, we are accountable to one another. We have had trusting relationships. Many of our data partners have not had the opportunity to have a lot of Black collaborators, and so it has really been a learning experience both ways. And we have lots of barriers, lots of gatekeepers, our health systems, our health departments, our elected officials, limited funding, data access has been the major barrier. And then the barrier for our population in all these channels of misinformation and disinformation. And so us trying to gather data on, the science and also what people perceive out in the community so that we can deal with some of these disparities. So thank you, and I look forward to the discussion.